Everyone, my name is Devon Joyner, and today I will be discussing an ethical dilemma portrayed in an ABC television series called The Good Doctor. I will be speaking about episode 4 in season 1 in particular, just in case you guys wanted to check it out. In this episode, a mother and a father had to make a life-changing decision about their unborn child. The mother, who's 36 years of age, is 22 weeks pregnant. And at a 16-week scan, the mother found out that the fetus had a tumor on its tailbone. So she was going into the hospital for a follow-up scan to check the progression of the tumor. And the follow-up scan revealed that the tumor had become even larger in size, so it was half the size of the fetus, which was endangering the fetus's life because though not cancerous, it was monopolizing the blood supply and weakening its heart. So there was a guarantee that there was no possible viability if it was left untreated. So Dr. Melendez, attending at surgeon at St. Bonaventure Hospital, suggested that the mom terminate the pregnancy because of her previous diagnosis of antiphospholipid syndrome, which was a disorder that attacks normal proteins in the blood. This meant that any surgical procedures to help the fetus would be risky and even fatal to the mother. So the fetal surgery, Dr. Sean Murphy then decided to suggest a fetal surgery to remove the baby from the womb, then remove the tumor, and then place the baby back into the womb, or the fetus back into the womb. And it still posed great risk for the mother. He proposed that heparin would be given to the mother to try to prevent blood clots, but nobody really knew if that would work out. So the mother decides that she wants to do the surgery. She's willing to take the risk, or whatever risk comes with having to save her baby. She wanted to save her baby after having 3 miscarriages prior to this. So she was ready, and the father, however, decided that he did not want to take the risk. He didn't want to take the risk and lose his wife and baby all at the same time. So he decided to go to the hospital's in-house attorney and vice president of risk management, Jessica Preston. He went to her to discuss his options, what he can do. So once he did that, Jessica Preston had to stop all proceedings. She had to make sure that the surgery could not take place until a board meeting had been conducted. So she stopped the surgery to consult the board, and the board then had to decide on what to do. The key challenges here were the fact that the mother has the right to choose. So the mother can choose what to do with her body. If she feels that she wants to have the surgery, she can have the surgery. However, the father would have rights once the baby was taken out of the womb, because then it's a baby and no longer a fetus. They say fetus. So once the fetus is removed from the womb, it becomes a baby. So he had rights to the child. He had parental rights to the child. So the ethical dilemma for the board was the legality of the situation. What should and what should not be done? Could this be done and inflict no harm? The dilemma impacts the mother, whose decision to have the surgery could impact her life. She could pass away the baby. Mental implications. There was so much that could go on from deciding to do the surgery, deciding against the surgery. Could also be harmful to her life, and she wouldn't be able to have what it is that she wanted, her stated desires. So with the father could lose both the wife and the baby, and he'd be left alone. So the surgery could impact him in a way, and impact the hospital's legality, liability of patient malpractice. So there's a lot that can go on, and a lot of people that can be impacted. The core values here are the dignity and worth of a person, where the board has to make a decision that for both the mother and the father, they have a right to be treated in a caring and respectful fashion. The board has to weigh the options. They have to think about the implications for the mother and the father. They have to do what's right for both of the people. So, and then service is another one of the core values, because the hospital must do what's best for the patient above their own personal interests. And in integrity, the board must act honestly and responsibly and promote ethical practices of the hospital. The hospital can be sued, or anything could happen. So those are the core values. There are several. Well, I had my two questions. My two questions are: what factors other than preservation of mental and physical health of the mother should be taken into consideration prior to a recommendation of induced abortion? And what are the harms of overriding the stated desires of a competent patient? So that's pretty much my entire video. So thank you guys for watching, and happy holidays.